Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. This is our fluid and electrolyte series, and this series will talk about the fluid, of course, fluid and electrolytes, acid-base balance, as well as bonds. So in this specific video, we're going to talk about fluid imbalances and the various type of IV fluids that we need to know. So let's get started. So fluids and electrolytes. So as we know, various health problems are due to changes in the fluid and electrolyte balance in the body. And as a nurse, you should always be aware to assess for this. So the body fluid percentage goes as follows. For an adult, 50 to 60% of the total weight is water. For infants, 70% to 80% of the total body weight is water. 2/3 of body fluids is intercellular, that's ICF, and 1/3 is extracellular. So intracellular is in the cell and extracellular is out of the cell. So a kilo, which is 2.2 pounds of body weight, is approximately a liter of fluid. So you see there's a lot of fluid according to surface area of an individual. So let's get into fluid imbalances. When we talk about fluid imbalances, we are either talking about you have too much fluid or you have less fluid. So with fluid imbalances, we could either have a fluid volume deficit, that means less, or a fluid volume excess, that means high. So let's talk about fluid deficit, right? Fluid volume deficit, FVD. Low fluid volume intake, less than body requirement, is a common type in isotonic dehydration. When we talk about isotonic, we'll talk about the various types of IV fluids: isotonic, hypotonic, hypertonic. So isotonic, in short, is the same amount of electrolytes is in the fluid is as well as the body is equal with the body fluid. So there will be no shift. So if somebody is being given an isotonic IV fluid, we are giving them a volume expander. We are increasing the volume in their blood. So some causes for fluid volume deficits include excessive GI or renal loss, like diuresis, diarrhea, vomiting. We could have diaphoresis. Somebody could be having fever, being on long-term NPO statins, hemorrhage, insufficient intake, burns, diuretic therapy, as well as aging individuals. With aging individual, they have a low sensation or a low threshold of thirst, so they are really not aware when they're thirsty and when they need to drink more fluids. Some signs and symptoms of fluid volume deficit include weight loss, dry mucosa membrane, elevated heart rate and respiration rate, a thready pulse, orthostatic hypertension, poor skin turgor. You remember skin turgor is when we check for, mostly with older age, like we check for dehydration. And some of the less signs include decreased CVP and flattened neck veins. The opposite of flattened neck veins is distended neck veins, which is jugular vein distension, and that is normally for the overfluid. So diagnosis is, how do we diagnose somebody is on or is undergoing fluid volume deficit? We can do a serum electrolytes, right? We'll draw the patient's blood, check their electrolyte levels. We can do BUN, creatinine. We can check the hematocrit may be high due to hemoconcentration, right? So that means there is less water particles than the hemoglobin. So it will be, the hematocrit will be high. We'll also check for their urine specific gravity as well as osmolarity, right? So if a patient comes in and they are having an issue with fluid volume deficit, as a nurse, what care would you give them? We will monitor their vital signs. Remember, they have a high respiration and a high heart rate. We'll check for their skin turgor. We'll observe their labs. We'll maintain a strict input and output, right? The output should be at least 0.5 ml per kilo per hour. So depending on how much your patient weighs, this is the formula of how to replace that body fluid, which is 0.5 ml per kilo per hour. And then we're going to measure daily weights just so that we know we're not overhydrating this patient. We're going to identify and correct the underlying cause of this. Fluid replacement, with fluid replacement, we're going to increase oral fluid intake. We'll also offer IV fluids for severe dehydration as per the doctor's orders, and we'll monitor the therapy responses or the outcomes as well. And this patient will place them as well on fall precautions. So our key treatment will be there to replace the electrolyte imbalances and as well as the IV fluids. That will be our main goal, treating a patient with fluid deficit. So if a patient comes with fluid volume excess, FVE. So what is FVE? This involves fluid intake or retention more than body requirement, that this patient is overhydrating or they're just holding on to that fluid. Some of the causes of this will be kidney failure, which is in the late phase, which makes sense. If our kidney is not functioning, we are not peeing, we are not letting go of that water. And then we could have heart failure patients as well, dysfunctional system. We have liver cirrhosis, intestinal plasma shifts. So like hypertonic fluids and burns, when somebody gets into the burn, there will be that shift. We'll have excessive water intake and long-term corticosteroid therapy. Remember, people who are on steroids, that's one of the issues with steroids. They tend to retain fluids, right? What are our signs and symptoms? With our respiration, we're going to know the patient will have crackles, dyspnea, coughing. They are coughing because the fluid is filling up in their respiratory system. With their circulatory system, we're going to note the patient will have this bounding pulse. They'll have tachycardia. They'll have tachypnea. They'll have an increased blood pressure because the patient is working hard to get rid of this fluid, right? The heart. They'll also have jugular vein distension, right? Increased central venous pressure as well as pitting edema. Remember, we need to note that a weight gain of 1 liter is equal to 1 kilo, which is 2.2 pounds of water. That's when they tell you if a patient gains a certain amount, like 5 pounds in a week, or they gain 2 pounds in a day or two, you need to let the doctor know because this is a lot of fluid. How do we diagnose somebody who's on fluid volume deficit? This is what we do. With the serum, which is the blood draw, we'll check for the electrolytes, the BUN, the creatinine, their hematocrit. They will be low because it will be overdiluted. Our urine, will check for urine specific gravity and osmolarity. For chest x-ray, we're going to check if the patient's respiratory system is involved, right? Because if they're having fluids, they're having fluid overload and it's backing up into the respiratory system. As a nurse, how do you take care of this patient? Of course, they have a risk of respiratory failure or respiratory compression, and we'll monitor their respiratory, their breath sounds. We'll check for edema. We'll check their vital signs. We'll check ascites, which is the water retaining in the abdominal cavity if it's cirrhosis. And remember, with ascites, we measure this patient daily. Any patient who's in fluid overload, we measure their weight daily, and ascites, we normally measure the stomach, right, at the largest part. And then we'll maintain a strict input and output, and we'll also administer diuretics, furosemide, spironolactone, to help this patient diurese, right? We should also maintain skin integrity. We'll place this patient on a semi-Fowler's position, right? When we place them on a semi-Fowler's position, it's because of that respiratory involvement. We are opening those lungs, helping this patient breathe well. And also, we'll reposition the patient every 2 hours, and they will be under a strict sodium intake. Why? Because wherever sodium goes, water follows. So if they're taking these foods high in sodium, they're increasing their risk of retaining this fluid. And with skin integrity, always remember, when patient is on a fluid overload status, their skin is pepper thin, very thin. So they have a high chance of having issues with the skin. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.